right, so let's just get into it. I have been meaning to record a few more storytelling type of episodes here on YouTube. And for those of you who don't know, I got my start on YouTube, it was more than 10 years ago now, where I created educational content for Khan Academy when I was in medical school. And I got permission from Khan Academy for the videos that I created to publish them on my own YouTube channel. So that's how I got started on YouTube. And I have been, over the years, trying to make my way back to YouTube. Of course, I went into residency and had zero time to make any sort of educational content. And then I had kids and then started my first job, and I started my own practice. So anyway, I'm slowly but surely getting back to creating content here on YouTube. And I just love the community here and the people who find me via this platform. I find that it's a place where I have a bit more time just to actually get into the nuance of things, whether it's teaching some concept related to biochemistry or psychedelics, or now exploring a bit more, sharing more about my own personal story, and doing maybe like Ask Me Anything type of episodes. So this episode was inspired by a fourth-year medical student who reached out to me on Instagram, and I have mentored very casually medical students or pre-med students all along the way. I've always felt really passionate about paying it forward and helping to guide the next generation of doctors. And it's such a special time when you're early on in your path because you're still so idealistic, and I love that energy, and beginner's mind and all of that, and just open to receiving information and so curious. And so I've always loved working with pre-med students and medical students and even residents too. And now I'm working with other physicians, other doctors. So I have a special place in my heart for helping doctors, because our healthcare system we're the leaders in the healthcare system, and the healthcare system is clearly struggling. I mean, it was struggling already when I first entered into medicine, and I was warned by people whose parents were already in medicine about going into medicine, but I couldn't imagine doing anything else. So anywho, this video is inspired by this fourth-year medical student who reached out to me, and she was asking, it was really also just like touched my heart, because she said she's a long-term fan from back in my Khan Academy MCAT days. So super cool to have people who have been in touch with me in this way for going on several years now. But she says, I'm currently entering my fourth year of medical school and had a really hard time choosing a specialty. I almost feel like we're told that our calling will just come to us during rotations, but that never really happened for me. I've decided to apply to internal medicine because I want more time to figure out exactly what I want to do, whether that's pursuing a fellowship, becoming certified in subspecialties like addiction medicine or obesity medicine, practicing outpatient medicine, or even opening a clinic. I'd love to hear more about your journey into orthopedic surgery. It's such a competitive field, so I imagine you must have been incredibly passionate and driven. So yeah, I'll share about my journey into choosing orthopedic surgery, which is what I trained in, and also now into psychedelic medicine, which is actually what I practice now. She also says, I also understand that you've spoken about feeling burned out and disheartened with medicine at times. I'd love to hear more about how you found yourself disillusioned. Was it due to the insurance system, the politics of medicine, or the lack of emphasis on holistic and preventative care? Finally, I'd appreciate any advice you have for those of us considering non-traditional career paths. It's hard not to feel anxious with all of the fear-mongering about AI, mid-levels, and other challenges that seem to be reshaping the landscape of inpatient medicine. I'd say outpatient medicine too. I'd love to hear any thoughts you might have on that as well. So awesome. So much to dig into here. Could probably make multiple videos just answering these things, but I'll start with high level. And if there's anything of particular interest or if this sparks any extra questions, I'd love to hear about them and just leave them in the comments, and I can use that to help direct future videos. So my journey into orthopedic surgery. Just to give you guys some context, I am 37 years old now, about to turn 38. I graduated from medical school in 2015, so 10 years ago now, which is wild to think about. And so I entered into medical school in 2011. And I went to the University of Virginia School of Medicine. I had known since I was young that I wanted to be a doctor. I had gotten really sick when I was 8 years old and was hospitalized with pneumonia. I actually thought at one point I wanted to be a pulmonologist, but that was my first exposure into the healthcare system and doctors and all that. I don't come from a family of anyone in medicine. That was my first exposure, and I loved science and did well in school and just had a yearning from very early on to want to help people. It's like a helper at heart, and to decrease suffering in the world. I feel like from a very early age, I was deeply attuned to the suffering in the world. I don't think my parents really shielded me from just major news and like things happening in the world. And so although I grew up, especially globally speaking, incredibly privileged materially, my family had other issues, but I still was like very attuned to the suffering in the world and just wanting to do my own small part in alleviating that suffering. And so, that meant becoming a doctor. From a very early age, I wanted to become a doctor. And so, from high school into college, I was formulating ideas. I was always reading about becoming a doctor. And I remember one of the first books I read was, I think it was called Baby ER. We borrowed it from the public library when I was in middle school, high school. And I read about this NICU specialist helping to save or practice neonatal medicine. And then I was very influenced by Atul Gawande's work. He's a surgeon. And then Paul Farmer, who founded Partners in Health. That got me interested in possibly in global medicine, practicing maybe one day with Doctors Without Borders. Like those are all kind of my realistic dreams when I was going into medicine. I also read a lot of Pauline Chen's work. She was a columnist for the Washington Post, I believe. And she just wrote about medicine. And I think I went into medical school. The first major fork in the road is whether or not you want to practice medicine or surgery. And I was fairly certain that I wanted to go down the surgical path. I was fascinated by the operating room, the ritual of all of it, the scrubbing and the donning of the gown and gloves, physically opening up the body, understanding human anatomy, and just very tangibly within a matter of hours, changing the course of somebody's healing journey. I was fascinated by surgery. I think I was also fascinated by just like the challenge of it. I was not daunted by a surgical residency. In fact, I would say I was like excited by it, like the challenge of it. And felt like, that's just something I was really interested in. I have a brother who's just a year younger than me, and he was Navy ROTC when we were in college, and then he ended up getting selected for Navy SEAL training. And so I always joke that this was the closest thing I could get to in terms of Navy SEAL training. We have like a penchant for pain in my family. I think I knew fairly early on going into medical school that I wanted to do surgery. And then it really was just a matter of like, what type of surgery did I want to practice? And when you go into medical school, the number one piece of advice that you receive, I feel like is, you receive so much advice from everybody, whether it's older medical students, other doctors, that sort of family, friends, that sort of thing. But the one piece of advice I remember, which I've always tried to practice, is I keep an open mind. You never know, allow yourself to be surprised about what you find yourself attracted to and wanting to pursue. And so I did keep an open mind. My first year and a half of medical school was just all theoretical classroom-based learning, problem case-based learning anyway, before getting into clerkships. And so you don't really know how medicine is practiced, although UVA was a pretty progressive medical school at the time, and they got us into the hospital as much as possible within that first year and a half. So I did get some exposure on the wards just to see what it was like, and in outpatient clinics as well. And I actually really enjoyed, in terms of like textbook, like more theoretical learning, I really enjoyed neurology actually, which is not surprising now that I find myself diving in these days much more into neuroscience primary literature. And but the actual practice of neurology didn't really appeal to me as much. Because, and I think this is something that you really don't understand until you become a medical student and you get in to see what it's like. But it was just, I found it really hard that there were so many ways that we couldn't intervene in time, especially when it comes to stroke or neurodegenerative conditions and that sort of thing. There's still so much that we have yet to learn about or innovate on in terms of those areas of medicine. And so it didn't seem like an area where I could feel really gratified or fulfilled, feeling like I made a real difference in people's lives. Although I think that was, looking back, like a bit of an illusion, because you still really don't know what is possible for you in any given area. The other thing that I always have said is that I could practice in any area of medicine and would have made it my own and loved it, I think. Like if I was just assigned, if we lived in if we lived under a communist regime, they're like, you will become this. Like, I think I would have made the best of it. Yeah, anyway, you get into clerkships and then you're like, okay, now I'm really like getting exposed to the different specialties. And there's all these things that go into choosing a specialty. I think another big one is what kind of colleagues or personalities you're going to be working with most of the time. It's kind of like Harry Potter and the Sorting Hat. You try to find like where your people are, and so there's that piece of it. What types of patients do you want to work with? Like, if you're OB/GYN, you're going to be working with exclusively women, for example, or if you're a pediatrician, you're going to be working exclusively with children and adolescents and not adults and the elderly, and then geriatric, so there's all different types of patients. I can share what drew me to orthopedic surgery was, well, one, like there's always, a joke that the stereotype is that the former jocks or athletes go into orthopedic surgery. And while that is certainly just a stereotype and many exceptions to that, and I don't necessarily I wasn't a college level athlete by any stretch, but I did play sports growing up, played club lacrosse in college. And so I very much had a passion for helping people to stay active and helping people to use their body, because our ability to physically use our body is so foundational in being healthy. That certainly played a role for me in choosing orthopedics. And then, of course, I was drawn to using my hands, surgical subspecialty. There's other factors, like I love the idea of working with men and women, children, and all the way over, from cradle to grave, as we say, and getting exposed to all of that. I also loved just how much fun orthopedic surgeons seem to have in the operating room. It's surprisingly, not all cases are like this, but so much of orthopedic surgery is at least elective in nature, and so most of the cases are planned. There's of course trauma as well, but the range of equipment you get to use, and just the people who are practicing orthopedic surgery, they seem to just really have a good time. And as far as quality of life goes, it seemed to be, I remember people pointing out to me, there are relatively few true emergencies in orthopedics. And so therefore your quality of life you can carve out somewhat of work-life balance within orthopedic surgery, unlike, say, neurosurgery or something like that, where you're basically like married, that your job is really the end all be all. And I knew that I wanted to have a family, that I wanted to become a mother. And so I could maybe envision a mostly elective based practice with orthopedic surgery after getting through residency. What else? Yeah, I actually was drawn to how competitive it is, one of the more competitive specialties to match into. I was actually drawn to that. Again, I with my competitive nature, I wanted to, there definitely was some aspect of me that was like, can I imagine to orthopedics, and can I do this? Rising to the challenge of it. Yeah, I think that's mostly how I settled on orthopedic surgery. I just thought it was cool and fun. The most cool and fun. I didn't really consider general surgery. It just seemed like too long of a road. Most of the programs are 7 years long. Orthopedic surgery is 5 years of general training with 1 year of fellowship, 6 years of training total for most people. And that's about, I would say, average. Like, even if I had gone into internal medicine and then chose a medicine subspecialty, it would have been 6 years of training, whether it's 3 and 3 or whatnot. So yeah, it didn't seem, even those like 6 years of additional training beyond medical school didn't seem too daunting. Yeah, that's how I ventured into orthopedic surgery. What else? It pays well. I guess like that was a consideration. It's wild how many people go into 6 figures of debt for medical school, and then it's very possible to end up in a job in medicine where you just don't make enough to actually ever pay off your student loans for several years. I did not want to end up in that position. So that was a consideration. And yeah, I think that's mostly it for how I ended up with orthopedic surgery. I guess the last thing I'll say about that is to wax more philosophical. Now I'm fascinated by consciousness and just how our brain constructs our reality and how we perceive reality and all of that. Even though they don't teach us anything about that in medical school, I was fascinated by how our body moves us through 3D space and how our bodies help to dictate so much of our perception of reality, and how the types of problems that people have related to their musculoskeletal system, it's so obvious to you when you have a problem with your musculoskeletal system, whereas it's not as obvious if you have, there's so many other kind of more silent chronic things that can happen, like diabetes or developing hypertension, that people just are you can be dissociated enough that you're not really aware that these things are happening, and you might not even, have found that a lot of those patients, like, they weren't really motivated necessarily to get better because they didn't even recognize that there was something wrong with them in the first place. But with an orthopedic problem, like, people are very motivated to get better. And so I found that while people may not listen to their primary care doctor when it comes to improving their hemoglobin A1C, if they have diabetes or quitting smoking, if they needed a hip or a knee replacement with us, like their hip and knee pain had gotten so bad that they wanted to get a hip or a knee replacement, and they had to meet the surgical criteria, or the pre-surgical criteria of quitting smoking and having an HbA1c of less than, whatever the threshold was, then they actually did it. It was incredible to see how, we would screen people for joint replacements. I did my residency in Los Angeles County at a county hospital, so Medicaid patients, and we are inundated, just huge backlog, years long, of people who are waiting for joint replacement surgery. And they would come and we'd do screening and say, hey, this is what you got to do. And wow, bam, 3 months later, they will have done it. It's just like, and I saw a little bit of that in medical school. And I was like, wow, these are very motivated patients. Great to work with people who are motivated. Yeah. And they actually want to see you and they want your help and that sort of thing. So, and then I ended up choosing pediatric orthopedic surgery. It was hard. Within orthopedic surgery, I considered, there are a number of subspecialties, whether it's spine, foot and ankle, trauma, oncology, hand and upper extremity, sports medicine. And I had narrowed it down to either pediatrics, oncology, or hand and upper extremity. And I honestly probably could have done any of them. I was drawn to pediatrics because I just loved working with children. They're little souls and spirits. The energy that they gave me was so regenerative for me. It just was something that really boosted my morale and spirit whenever I did get a chance to work with children, which wasn't a ton in residency. And I loved the depth and breadth of it, unlike being a joint joint replacement surgeon where it's hips or knees, mostly for arthritis. With pediatric orthopedic surgery, there's like you do like congenital hip dysplasia all the way to sports medicine, ACL reconstructions. You're a generalist, and I did spinal reconstructions for scoliosis. Like there's just a breadth of and diversity to your practice that I really was drawn to. It makes it more challenging. At times you can feel like a jack of all trades, master of none, but that's, everything's a trade-off. Even though I don't currently practice pediatric orthopedic surgery, so much of it is actually education based. And so I really loved that piece of it as well, just educating parents, educating kids on like how to be healthy generally. I also understand that you've spoken about feeling burned out and disheartened with medicine at times. I'd love to hear more about how you found yourself disillusioned. What was it due to? Was it due to the insurance system, politics of medicine, or the lack of emphasis on holistic and preventative care? I mean, all of the above. There's many reasons to feel disillusioned with medicine. Politics of medicine honestly hasn't really become a thing until I think more recently. That was not initially what made me feel so disillusioned on modern medicine, but I actually wrote a thread on Twitter that's the only thing I've had go like semi-viral about feeling burnt out, the disillusionment, the chronic PTSD that no one wants to talk about in healthcare, really just becoming a doctor more specifically. And I would say I became maximally disillusioned probably, honestly, like my fourth year of med school, which is funny because I'm making this for a fourth year med student. And I actually spoke with another fourth year med student recently who was feeling a bit lost about what to practice within medicine. You work so hard to get into medical school as a pre-med, or if you do a post-bac, and then you finally get in the bottleneck of even just getting accepted into medical school, which is already so hard. And then I feel like I should have been feeling like I was on track in life, like on purpose to a fulfilling career. And I was getting exposed to so many people who weren't fulfilled and, who were doctors or were clinicians and just like weren't super fulfilled, or they had, you start to shadow people and you start to envision like yourself being like in their shoes and living their life. And it was like, oh my gosh, I don't know that this person is living my dream life. And when you're in your 20s, you're still like, I think all of us are always striving to like live out a dream. And of course, like real life is not as idealistic and perfect as the vision that you dream about. But the level of burnout, I mean, it's no secret in medicine, is just rampant. And I think a lot of it is actually due to just misaligned incentives and the way that the system, I mean, it's a behemoth of a system with insane bureaucracy and regulations. It's one of the highest regulated industries. And I think it's no surprise that we have all of the inefficiencies that we have because of how poorly regulated it is. And so with all of the misalignment of incentives, like we end up serving those misaligned incentives rather than serving the patient. Yeah, there's many reasons for all of that. Again, I could probably do like 10 other videos on sort of my assessments of how the incentives are misaligned. And honestly, if I could just like boil it down to one thing, it would be because the person who is receiving the services and care is not paying for the care, it's a third party. You have to understand that it's the third party that's paying that is actually the one dictating everything. Whoever pays for it dictates the incentives. That's who you're serving. And so I think when you wake up to that and you see that, it's like very disheartening, and it's tough because like we struggle with like, is healthcare a human right? Can you have a human right that's based on human labor? Like, does anyone have a right to human labor? And like all of these things. And I don't know what the answer is. Is it free market healthcare? Is it direct care? I don't know exactly, but I do know that when you have that fundamental distortion in the system, then it's going to be difficult to serve in the interest of the patient. That's part of what inspired me to start my own practice, where I get to just interact directly with patients and clients, and serve them the way that I'd like to serve them, and not how the insurance company dictates I serve, or the my employer dictates how I serve, or anything like that. And so, yeah, I think part of it too was, I trained in South Central Los Angeles in a county hospital. Like I said, it was a safety net hospital, like 100% Medicaid patients, and just the social ills that I came face to face with in that hospital were eye-opening. And what I realized along the way is how much intergenerational trauma and intergenerational poverty and intergenerational childhood, adverse childhood experiences, and childhood trauma play a role in the manifestation of disease. We had a saying in my hospital that we were heavily orthopedic trauma based. And, whether it was, gang violence in LA, so gunshot wounds, a ton of gunshot wounds, stabbings, a lot of like highway accidents. So people who get run over because they're intoxicated, or people riding their bikes and getting run over, accidents because people are intoxicated. The drug use that is just insanely prevalent, whether it's PCP or meth. And I really was deep in the soul searching about, like, how do we help people? How do we break the cycle of trauma? And part of what was disheartening was, we would spend hours fixing someone up who had had terrible multiple injuries, multiple limbs, and piece them back together, only to have this person, and they had, no social support whatsoever, and were just like their personal lives were just a total mess, only to have the person roll back in six months later at the same situation. So it just felt like what we were doing was not really helping people. It's just a Band-Aid. And so I got really curious about how to actually heal at the root level. And that coincided with my own healing journey. And then, not to mention the EHR, spending more time in front of a computer than in front of patients, the documentation burdens, the trouble, like the lack of interoperability. It was just wild to see all this innovation happening in like the consumer space digitally, and then no innovation happening in medicine, like going right back to working on a computer running what felt like Windows 95. And I just remember, I don't know if this still happens, but like, I just remember like literally my job as an intern was to take data from the electronic health record and put it into a spreadsheet. That was like the list that we managed. And it was maddening. I was just like, that's what I spent most of my time doing. And also just like how toxic the work environment was. Like so many, it's not surprising because especially in a teaching hospital, people are sleep deprived. They haven't been meeting any of their own self-care needs, and they are working all the time. And then people were just like nasty to each other. Just wild how unprofessional it all was. And the fighting and the bickering and the territorial nature between specialties. Like there was just like a lack of collaboration across specialties oftentimes for patients. And so, yeah, that part was also just like, I'm just like, what are we doing here? A lot of times, like I talked about, like finding your people in life when you're working, and like so many times I'd be sitting in a room and being like, I don't know if these are my people. I'm just like, where's the heart and the humanity and the compassion and the patience and the grace? And there was like none of that. So yeah, I don't even know if I like totally covered how like that was like that was one phase of feeling disillusioned. And then the next phase, I would say, was when you're in training, you kind of put your head down and you're like, I just need to get through residency and get through, my training. And then when I'm finally attending, I'll have a little bit more autonomy. And while that is true, you have a bit more, it still depends on what system you end up or practice setting that you end up in and who you're working with. It all comes down to people. That's probably my number one piece of advice with like how to choose a residency or your first job. Is like always go with the people. That's what matters the most, the relationships that you develop. It doesn't matter how prestigious a place is or like any of those things, like go based off of the people. And when I was in my first job, so much room for improvement, of course, wherever you go. And I was starting out with like a ton of energy and I had all these ideas for improving things. And what I consistently came up against was the type of individual who figured out how to cope and like make their way up the chain to where they're finally in a position of power in the system. And here I was, this young kind of upstart wanting to come in and fix things. And the attitude was, well, this is the way that it's always been done, which drove me crazy. I can't stand that mindset. And so I was just stonewalled like again and again when I was trying to make various changes for better patient care, make things better for other attendings, that sort of thing. And it just, it just wasn't met with any kind of support. So that was one of the many things that led me to finally taking the leap to work for myself. Oh, one thing I wanted to touch on was the lack of emphasis on holistic and preventative care. This is like such a big one, and why I practice nothing but preventative care now, pretty much. But we have a sick care system. I think that's no secret. And the way that our system makes money is by intervening when people are already sick. And so and there's a real cynical part of me that like can start to really go down the path of like, the system actually profits off of people being chronically ill or sick or not actually ever getting better. And so, I would say like that was definitely a part of it. And I found that like where my passion lay with my patients was in the preventative holistic care, whether it was talking to patients about their sleep hygiene or how their nutrition was, or how especially like their mindset and their mental health was. And also, dare I say, spiritual health, like that's totally neglected in our healthcare system. And I feel like that's such a core part is like, if you have someone who's like good spiritually, they can overcome anything. And if you have somebody who's spiritually unwell, that person is like, must go through their own dark night of the soul before they have their own awakening. And so there's just no room for that whatsoever. And that part of things also just didn't feel totally true to the person that I have become and the way that I like to practice medicine now. All right, last piece. I'd appreciate any advice you have for those of us considering non-traditional career paths. Definitely feeling some anxiety around the future of medicine, and any of my thoughts on that. First of all, the future is always uncertain. And there is talks of this. I remember when I was in medical school about, especially for primary care providers, and the encroachment and all of that, and the increasing commoditization of medicine. And it's like definitely something to be aware of, but also I'm such a believer in you create your own destiny. Being a really high agency person who just relentlessly believes that no matter what, you'll eventually be successful at whatever you set your mind to. And so that's always how I've been. And I think that's like whether or not you can unlock true high agency, true ownership. And that to me is true empowerment. And then you always have that trust that like you're going to be okay no matter what happens. Like you're an adaptable, resilient, smart person and have so much human capital with having a medical degree. It's like you can do whatever you want. The world is your oyster. And so, yeah, like I'm a huge proponent of non-traditional career paths. I mean, I'm living it. I trained in orthopedic surgery, and then like now I practice psychedelic medicine. I pretty much teach only about psychedelic medicine, psilocybin therapy in particular. Practicing consciousness medicine is another way to conceptualize it. But I put it in the category of well-being and longevity, preventative medicine, lifestyle medicine. And I was a non-traditional medical student even. So it's not, and I've always envisioned having a very varied career path. I never saw myself doing just one thing for the rest of my life, and just being in one position and just one place and always just doing that. And I think part of it was I had a nomadic upbringing, so I moved around a lot. I was exposed to a lot of different people with all different kind of life trajectories, and I was most enamored with whether if it was reading a biography of someone or just getting exposed to someone who had many different careers, or polymaths, as you know, the people who, if you ever read, I don't know, I love reading biographies of just people in the past, like inspirational lives from the past. And it's just like so many times you see this person was an author, a scientist, an artist, like many different things. I think allowing yourself to grow and evolve and just follow what lights you up is the best gift you can give to yourself. And all you can do in the current moment is just to follow your heart, and you make the decision with the best decision you can with the information that you have, with the current level of awareness that you have, and you just trust that life is leading you in a particular direction as long as you follow your heart and stay true to yourself. I think that's like the golden thread for me, where I haven't lost my way, is just by following what's true. It's so easy to be tempted by money and prestige and ego and status and all those things. And I'm not saying I'm immune to all of that, or I haven't been in the past. You know, I talked about orthopedic surgery is nice because it also is one of the highest paying specialties. Like, I don't think there's anything wrong with making money and being financially well off, but it's not the only thing. And money solves your money problems, and that's about it. I can say that for sure now at this point in my life. And so, yeah, like I think that one of, what do I want to say next with this? I remember coming across this quote when I was in residency, that, you know, the way you can think about what you're doing day to day, whether you're a carpenter or you're a doctor or you're a teacher or you're a garbage man, like that it's not about the thing that you're doing, it's about your relationship to it and how you're allowing it to develop your character. And so no matter which direction you go in medicine, the field is just so ripe. Just the practice of medicine is so ripe for learning and for your own personal development and evolution that you can't go wrong no matter what path you end up going on. And also, like when you're in medical school and in residency, you're in a teaching and academic setting, and that's actually a smaller part of the greater healthcare system. Most of healthcare is outside of an academic or teaching setting, and so there's just a whole huge world out there. That's another piece of advice I find myself coming back to giving to people, is that the world is so much bigger and there's so many more things going on than just like the little bubble that you're currently inhabiting. And I feel like each step of the way, whether it was like from, you know, high school to college to med school to residency, like beyond residency, that there's just this huge world out there and so many people doing so many cool things. And you just never know who you're gonna cross paths with that will change the trajectory of your life. And you can't predict that. And it's just like one of those delightfully surprising things that life only makes sense in hindsight, in retrospect. You can connect the dots and see like, oh yeah, like that's why that happened, that led to this and this, and it makes sense in hindsight. But when you're moving forward, it oftentimes feels like, I don't know if I'm on the right path. And so I think there's always this deeper intuition when you quiet your mind and all of the thoughts and all of the external voices and all of the things that we project onto ourselves by our family, society, all of these other expectations. And you get really quiet and really still and tune into your own heart and what's true for you. Then you can't go wrong with that. That's like my biggest piece of advice, and hence why I'm such a huge proponent of psychedelics and meditation, because what it does is help you to release all of the limiting beliefs and conditioning that you accumulate in your life, and to basically get a fresh blanket of snow, and then you get to carve your own path. I love the rocking chair test. So the rocking chair test is like whenever you're making a decision in your life, you can ask yourself, one frame you can use for decision making is like, when I'm sitting in my rocking chair when I'm 90 years old and I'm looking back on my life, will I be proud of the decision or will I regret the decisions? And continuously when you I love listening to interviews of people who are much older and the life advice that they give. And one of the most common pieces of advice that or regrets that people have when they're older, like in the rocking chair test, is that they regret not taking the chance, not making the leap, not going leaving the default path and going on their own path. And so that's really stuck with me. And when I think about the kind of life that I want to live, it's very much I'm just cut from the cloth that needs to chart my own path or go the pathless path and figure things out and in what's a blue ocean. And so that's what I'm doing now. And that was the inspiration, one of the main inspirations for why I decided to leave my job in big medicine and conventional medicine and start my own practice. And it gives me a chance now to, one, have way better work-life balance. I have a way better lifestyle now. But two, I get to create content like this and just pursue the things that I'm just truly passionate about, which is helping med students and other people who are just on the path. So anyways, hope this helps. If you stuck with me to the end, wow, amazing. If you have any other questions or comments, please leave them down below. I love reading them so much. And until next time.